Hello, hello, hello. Welcome to Dr. Talks Show on blackdoctor.org and on my Facebook Facebook page and YouTube channel. Sorry, I was just checking. I just saw something flash across saying that my Wi-Fi wasn't stable. So I hope that we can get through this without freezing too much. If not, I'll repeat it or repost and record and repost. So, for those of you who are tuning in, thank you very much for showing up. Thank you. And at the end, I'll have an opportunity for you to ask me questions. And for those of you who are tuning in for the first time, I'm Dr. Catherine Toomer. I am a family medicine and community health physician. I'm also the founder of Total Weight Care Institute. And I talk a lot about health, wellness, and weight care in all its forms, in all its glory. And I also help people maximize their health and wellness through weight loss, and I teach physicians how to provide compassionate and caring and complete weight care for their patients so that they can be totally healthy. So, and so really within my realm, there's nothing that's off limits. So if there's any topic you'd like me to talk about, please leave me a message either in the comments here. I do see them and I keep track, or on my YouTube channel, or just you can DM me or send me an email at courage@drtoomer.com. So today I wanted to talk about the how exceptionalism or the exceptions are sort of can be problematic for some of us. Actually, for many of us, we there's so that what we consider normal or the norm is what is usual and what we expect. What is exceptional are things that are outside of the norm, that are not typical. So, what happens in the weight care space is often that things that are really the exception are being touted as the norm. And that can be a problem, particularly for someone who's just starting out in a process and who's looking for examples of what to expect and seeing these extreme examples of what can happen and whether they're true or not true. That's one of the problems of finding things on the internet, reading stories. You just never know if they're actually true or not. But when not being careful, when looking at stories or hearing stories or seeing results in other people, if we're not careful to determine whether what they did was absolutely normal, absolutely true, and also not recognizing that even if it is true, that it's the exception and not the norm, then what that can do is it warps our expectations of what should happen. And when our expectations are warped, our expectations have been altered in some way. What that does is that as we move along what is considered a normal process, we think it's abnormal. And if we think it's abnormal, then one of two things happen. We blame ourselves, we internalize it, or um, we think that we're doing it wrong. When in fact, what's happening is absolutely normal. Perfect example of this is I often, people who know me, who followed me, know that I prescribe quite a bit of GLP-1s, which are the what people call the weight loss shot. Which, of course, as anyone knows, it's a misnomer. They do not help you lose weight. They are not weight loss medications. What they are weight gain prevention and reversal medications. There is a distinction. And so one of the things that in prescribing these medications, which I've done for many, many years, even long before Saxenda came out, I was using it off label for weight management. But one of the things that started happening with the advent of the internet and the internet getting a hold of these medications and kind of the stories is that people have lost significant amount of weight very, very quickly. And so what that's done is warped other people's expectations of what should happen using these medications to lose weight. The problem is that in diet culture, we have always had people who have gone to extremes. We've always had people who have abused medications, who have gone to great lengths, unhealthy lengths to lose weight, and now some people are using these medications to do it. And so they're getting really outlandish results, which are the exception and not the rule. But what's happening is there are people on the medications who are expecting the same results when in fact those results are unhealthy and they shouldn't even be obtainable. They shouldn't be what you want. And so, but what that help does is that when we feel like we're the problem, we feel like everybody else is having a success that we're not. Often what happens is then we internalize these failures that aren't real failures, and then we it affects our self-esteem, our sense of self-worth. And so, and then which often then leads to our negative self-talk. And I've talked about this before, how when we talk negatively to ourselves, our body can't tell the difference between us being the bully or someone else being the bully. And so our cortisol levels shoot straight up, and then it becomes completely counterproductive. Cortisol makes our body fat-making machines. So when you're hard on yourself, all that does is make it worse. So again, it does affect expectations and falsely changes expectations of what a process should be. The other that it can do is lead to extreme behaviors, unhealthy behaviors, because we'll see what someone else has done and try to mimic their results. And in a weight care space, that can be dangerous. That can be, um, it can lead to eating disorders or disordered eating. It can lead to extreme exercise to the point where injuries then occur, which then again is counterproductive because if you injure yourself, you can't do the things that are healthy. It also can disrupt relationships. If the expectations are extreme and the results are not, sometimes that can lead to certain jealousies. It can lead to friction friends, between friends, or between family members. It can also cause um, accusatory language to be used, and that can be a problem. And so, just to reiterate again, when something's the norm, it should be normal, it's the usual. But when something is the exception being touted as the norm, then that's where we have toxicity. And that's where we have a problem with disrupting people's expectations for themselves and then also altering their behaviors to try and mimic again what it was that they were seeing. So, how do you then counter this? One of the ways is to choose what you hear very, very carefully. Cultivate your exposure. Follow physicians who have the expertise and the knowledge and the education, the expertise, and I say and the experience that all lead to being knowledgeable in a particular subject, particularly with weight care, particularly with weight health. It is too easy to have a lot of misinformation and danger in that information if not followed properly. And so the other is keep score of those people who do not support you in your efforts. Then don't share those efforts with those people. You have to protect your process. It's yours, it's important, and you need to protect it just like you'd protect anything else that's important to you. The other is to, when I say cultivate what happens on social media, what that also means is you can like kind of block people. You can unfollow people who give misleading information. You can block and follow people that make you feel a certain way. It doesn't mean that they're bad people, but they're bad for you. And if they're bad for you, then limit their exposure to you and your exposure to them. And that's really important. Um, I always say if it makes you feel some kind of way, then it's some that some kind of way should be away from them because that's really um, what that means. If it disrupts your peace, protect your peace at all costs. And sometimes, of course, it's family members, but just like some people can be good people but not good for you. You don't necessarily have to block family members, but you can stop following them, and therefore you're not exposed to their false narratives, because that's really what the exceptions are. They're false narratives. And limit social media. I know that's difficult, and that kind of it seems a bit hypocritical because you're on social media listening to me right now. But you can, when you know that there's things that are scheduled at a particular time, you can just come on for that amount of time, listen, and then move away. Or don't watch things live. Watch them at a different time when as a replay, so that way you're not kind of seeing all the different things that are coming at you at once, because as soon as you come on social media, you see it, the notifications start, they get really, you get distracted. And so, if that's a problem for you, if you don't feel bad, then it's fine. But if you notice that you're starting to kind of affect your spirit, then limit that. But it's really important to pay attention to these things, mainly because they can cause problems. Um, it's too easy to fall victim to the shaming, as even if that shaming is us to us. Self-shaming is just as much of a problem as societal shaming, and we've internalized a lot of that shame. I know, as someone who's lost over 100 pounds, and when I was much heavier, it was so easy to blame myself for every single thing that happened, because I would see other things out there that I knew were successful, and I just thought I should be able to do that too. Of course, not understanding then, like many of us do now, that there's an underlying metabolic process that had to be corrected first. The other is that self-doubt feeds on itself. It's insidious, and it grows, and it gets bigger, and if you don't, nip it in the bud, it will get worse. Anything you don't address that eats away at you will continue to eat away until it's stopped. And the other is that it can cause a lot of overwhelm and a sense of this need to be perfect. Overwhelm and perfection are the killers, or I should say the enemy of progress. And I'm going to say that again. Overwhelm and perfection, overwhelm caused by a sense of perfection, perfection causing overwhelm, is the enemy of progress. And so in any type of process, you want to make sure that whatever you're doing doesn't overwhelm you, and that you eliminate this sense of needing to be perfect at it, because there is no such thing as perfection when it comes to your health. It is a journey. It's like saying there's a perfect way to drive from New York to California. There isn't. It depends on who you are, what you want to see, how long you want to take to get there, what kind of car you're driving, what kind of vehicle. But there's lots of different ways to get from New York to California. This is the exact same thing. There are lots of different ways to be healthy, to be healthier, to get healthy, to lose weight if that's your goal. And so there is no perfect way. There is no one way. And that's why um, comparing yourself to other people will absolutely kill your hopes and dreams. And it just really does disrupt a process. Um, and then often, because you're comparing yourself to someone who may or may not be telling the truth. I can't tell you how many people, well, it's not doesn't happen very often, but there are some people who I absolutely know for a fact have lost weight using medication, which is fine because that's what they're designed for, to help reverse the causes of weight gain, the metabolic causes of weight gain, which many of us have. But then take their weight loss and use it to guide people in ways that aren't in how they lost it, with, lifestyle changes and exercise. And yes, they may have exercised and they may have made lifestyle changes, but it was their metabolic correction that led to their weight loss. And so you can't always believe everything you see, and you cannot believe everything you think. And so one of the things that I always talk about is my M.E.M.O method. It's M.E.M.O. And what that means is minimal effort for maximum outcome. There is always a point where you're just doing too much, where it's just extra and is not giving you a whole lot of benefit. And so the point is to find that point where you get the results you want, albeit normally are slow. It's supposed to be slow. You want it to be a slow, nice, steady pace. You minimal effort, but you get the most out of it, because there's going to be a point where you can't get any more out of it. It's sort of like driving a car. You want to get to the point where you can cruise, because if you push your foot all the way down on the accelerator, there's going to come a point where the car's not going to go any faster. It's going to go fast, but it's not going to go any faster just because you're pushing the pedal harder. So all you're doing is doing something harder, and it's not giving you better results. And that's essentially what M.E.M.O is. You find that point where the least amount you have to do in order to get the maximum outcome, whether it's in how you eat, whether it's in what you do in exercise, whether it's in how you de-stress, if it's in how you get enough sleep, if it's, if you drink enough water, eat enough protein, eat enough calories, whatever the process is, there is a point where doing too much is not going to help you all that much. And so for every single person, that point of maximum outcome with minimal effort is different. And it takes tweaking on every different pillar of health to figure it out. And when you do them one at a time, it's easier. But when you're doing multiple at one time, it's really hard to figure out which one's causing what result. And so doing it stepwise, this isn't a sprint, it's a marathon. You just take your time and you just go through things methodically and intentionally. So again, I'm Dr. Catherine Toomer. I am a family medicine and community health physician and founder of Total Weight Care Institute. I'm also the host of, Dr. Toomer Talks Show on blackdoctor.org and on our Facebook pages and our YouTube channels, where you can find me. And if you want to ask me questions, you can in the comments. If you want to work with me, you can contact me through my website, drtoomer.com. And or you can join one of my Facebook groups. And if you're interested, just let me know. And I can give you I'll probably end up posting them as a comment after this, just to let people know how they can join my groups, because that's where I go in and I do a lot of coaching and I do a lot of educating. And so for people who don't necessarily want to work with me but want my information, that's a way of getting it. All right. So I'm going to go through the comments because there are a few here. And so thank you, Aunt Cynthia, for watching. I appreciate you being here. And Jennifer Nebraska says, I've been stressing about a slight weight gain, lost 93 pounds, then regained 11. I was firmly on the struggle bus. For the past 2 weeks, I didn't weigh and relaxed. Weight came down, 94-pound loss. Yes. And that's really what happens. Stress is a weight loss killer. And it's not even so much as a weight loss killer. What it does is that weight gain is a way of letting you know that you're under stress. Weight, again, is a symptom. It's only a symptom of something else that's going on. And stress is one of those things that can make you gain faster than anything else. So Chris says, That's correct. Okay, family members can be the most difficult to keep distance from, and it seems to be the most negative. That is true. And so managing negative relatives is a lifelong skill. It's a lifelong thing that you have to work on. But when you're on social media, at the very least, you can unfollow. You don't have to block or unfriend people so that it's obvious that you're kind of distancing yourself. But you can make it so that your feed is more positive, and so you don't get a lot of the negative comments. And if you do, you can also hide comments in your posts, so you don't read them over and over and over again every time you get a notification. Um, so it said, I did find the warrior class wasn't really helping as much as I thought it once was, so I stopped, and it's not seeing any negative results from it. I'm not sure exactly what that means, but I'm assuming that's some type of an exercise. Sounds like a warrior. I don't know. It seems too extreme for me, so that's probably why I don't know much about it, because I'm a moderate. I'm like do everything in moderation type person. So, um, yeah, warrior is a mindset as far as I'm concerned. If it's something physical, I'll probably pass and then just do something like a modified version of that. Um, let me see. Yes, my mother has been for a visit. She's heavy too, but doesn't stop her hurtful words. Well, mainly because those that's self-incrimination, that self-worth, the self-esteem issues are are difficult. And often what we'll do, rather than insulting ourselves, we're insulting ourselves in our head, but then we insult other people who look like us or who represent who what we don't like about ourselves maybe, or who remind us that we don't like very much. And so they'll lash out. And that's usually the person. It's on the person. It's on the person putting out the negativity, not the person who's receiving it. Unfortunately, we do tend to blame ourselves, particularly when it's our mother. I mean, it's one of those family relationships that is very, very difficult to manage when it's negative. Um, well, it seems like we got through all of the comments rather quickly today. Um, well, thank you for coming. If you're watching now, I appreciate you showing up. And then you can always put hashtag replay, and we can watch when you watch later. And also, you can leave comments on my YouTube channel. I do see them and I do respond. So, thank you very much for coming. And I will see you next week for Dr. Toomer Talks on Tuesday. Good night.